Thank you, Presiding Officer. And like others, let me both thank Daniel Johnson for giving the opportunity to have this debate, but also congratulate him on the very individual and particular contribution he is able to make and the real courage it takes to make it. Fortunately, I'm not in a position where I have to exercise that kind of choice. Some members here may have heard me previously talk about the first job I had when I left school. For about 8 months, I worked in a psychiatric hospital in a locked ward in 1964, just at the point where the very first medications were becoming available that would enable people with quite a wide range of psychiatric and other conditions to get something better than simply being locked up in the old asylum. The asylum in which I worked had about 1,200 patients. Today, the hospital that sits on that site has around 100 patients. So my starting point is that medication is an important part of dealing with a wide range of conditions, ADHD being one of them. However, I think I, like others, thank the coalition for their contribution at the debate and the briefing, and they talk about a survey they did of parents, and they refer to medication, parent training, school interventions, and psychological support. And I haven't, I must confess, watched the Netflix film. I take Daniel Johnson's word for what's in it, supplemented by what Emma Harper has said. But I did see just a few weeks ago on BBC4, The Doctor Who Gave Up on Drugs, 23rd of May, 2018, BBC4. And it was interesting because he was using a mindfulness approach to support school students who had ADHD. Not getting them off the drugs, but giving them a choice and giving them space. And I was quite impressed, but of course television programs always short-circuit complexities, and we need to be very careful about that. I'm not assuming that the magic bullet was contained in that 1 hour of television. But I think it leads us to an important general point, and that is our use of the word and the concept of normal. I think we increasingly view normal as a much narrower range than it's proper to consider. I think normal is anything, behaviours, aptitudes, abilities, conditions, that does not harm the individual or cause the individual to harm anyone else. We should review normal as covering a much wider range, a much wider variety. I mean, I have my own phobias. I can't come into here without getting to my office. I'm generally first in on the 4th floor without straightening up all the rubbish bins. It's just something I feel compelled to do. I virtually won't use the phone. I'm virtually phobic on that. And personally, I hate pills. But there is a reason for that, because I was in an experimental drug program for a particular condition I had at the time when I was 12. And it didn't sort the condition, but it's left me with lifelong issues associated with that trial. So I personally use self-hypnosis to deal with pain and with my asthma. So I haven't taken medication for asthma now for 35 years. But I'm fortunate. I'm able to do that because my condition probably isn't severe enough to require medication. And isn't that to the heart of the whole thing? We have to treat people as individuals and find individual treatments that suit them. And it will be a mix of medications, perhaps, a mix of psychological support, a mix of family and educational system support. And it's that diversity and that range of what is normal that we should perhaps think about when we think about this issue. Once again, Daniel Johnson deserves our thanks for raising it in this context and showing us that there is more to this, or perhaps less to this, than we might have otherwise thought. Presiding Officer.